There was a march into the State House today to protest the high cost of prescription drugs. A coalition of advocates, consumers, and policymakers delivered checks to legislators for the $70 million in savings they'd receive if a new provision is passed in the state budget. The provision is sponsored by House Rep. Christine Barber and State Senator Jason Lewis.
My mom, as does everyone in this state and in this country, deserve better than to have to choose between basic expenses and health care. They deserve better than to lose their life over not being able to afford a basic life-saving medication.
I'm a type 1 diabetic, and my insulin costs me $1,400 a month, and I'm on Medicare. And the only way I can get around this is to make trips to Canada to afford my medicine, and I don't think that's right.
The bill that we're proposing today is making sure that everyone knows how much these medicines should cost and having some transparency metrics and accountability metrics so that these companies can continue to produce these medicines, but most importantly that people can actually afford them. Because a medicine that's produced that no one can afford doesn't help anyone.
For many of us, we would see being able to get your insulin a human right, but for pharmaceutical companies, this has really just been about the bottom line. And while many are struggling on how to be able to survive, the pharmaceutical companies are putting billions of dollars in their pocket and not investing in the marketing and research that they say they are. Meanwhile, there are many who are struggling to figure out how they can be able to get their life-saving medication.
And prescription drugs only work if people can actually get access to them, and we know there's great innovation here in Massachusetts. We want to make sure that everyone can afford and access those drugs.